Many South Africans have been complaining about the side effects of the vaccine after receiving their shots. But how many know if they are harmed as a result of their vaccination? They can submit a claim to the National Vaccine Inquiry Compensation Program, which will then pay them for the injury that's sustained. Each claim will be assessed by a panel of experts who will determine if the injury was indeed caused by the vaccine. To talk to us more about the side effects of vaccinations and the Vaccine Injury Fund, we're joined now by senior health journalist at Bhekisisa, Joan van Dyk, and general practitioner, Dr Marlin Mackay. A very good evening to both of you and welcome to News at Prime tonight. Perhaps let's start with you, with Joan. As far as research is concerned, how far is the implementation of the Vaccine Injury Compensation Fund?
So this fund is something that was kind of one of the strings that came attached to the deals with the drug manufacturers to get COVID vaccines into South Africa. So this fund had to be implemented and put in place incredibly quickly. So as far as I know, it's already been created. The regulations and things were put out back in April already. I don't think we've had any claims to it at this point.
So, Dr. Mackay, as far as claims are concerned, according to what we've been reading here, it says that one has to be able to prove that there have been dire side effects from COVID-19. What type of side effects are actually covered under these claims?
So the first thing that will have to happen is that the injury, it should be a vaccine injury. It should be a significant injury. And of course, there must be proof that the injury was caused directly by the vaccine itself. Of course, many things can happen around the time that one can have the vaccine. But we say medicine association does not necessarily mean causality. In other words, if someone dies around the time that they had the vaccine or a few days after it, you have to prove that it was actually the vaccine and not something else, because one can still die of a heart attack or stroke unrelated to the vaccine. So that can be quite a challenge. We know that the common side effects are local, which is the arm, painful arm, a rash around the arm, swelling around the arm. And then the more systemic side effects would be things like fever, chills, body aches and pains, almost like flu-like symptoms. So real vaccine injury-related cases are quite rare and few and far between. Obviously, from worldwide data, we can see that, for instance, the Johnson & Johnson vaccine, there's been cases of these so-called clots or vaccine-induced thrombosis. There's allergic reactions, and I think the anaphylactic or allergic reactions would really fall under those because they can be quite serious and life-threatening and directly attributed to the vaccine. But by and large, even in my practice and my experience so far with COVID, I haven't really come across any serious vaccine injuries, which in my opinion may result in a payout, as it were, as a result of that.
Dr. Mackay, you said one needs to prove that the cause of death was directly related to having taken the vaccine, and you used heart failure or heart attack as an example. Because the testing with the vaccination is still ongoing, what about instances where perhaps the taking or the ingesting of the vaccine itself exacerbated an already existing heart condition? In a situation where had you not taken the vaccine, then you would have perhaps lived a good 20 more years with an existing heart condition. But because you've taken the vaccine, that has somehow acted as some sort of a catalyst towards your death. How are those type of dynamics then considered?
Yeah, so that's a good theoretical example, but in reality, and remember these vaccines have been tested on thousands and thousands and thousands of individuals, even before it came so-called to market, where we as ordinary South Africans could get them. And so many of the adverse effects of the vaccines are well documented, well researched, and well known. And so just think of it, a vaccine really, when you are given a vaccine, it's really a piece of dead material that is injected into you. And all it does, it stimulates your immune system to generate antibodies. It does nothing else. So you can see the risk of something like that happening, or the chance of something like that affecting your heart is very, very rare. extremely rare and will even be extremely hard to prove. It will be easier to prove that that person probably had a pre-existing heart complaint, and just because it was around the time that they had the vaccine, something happened to the heart. It will be very difficult to prove that the vaccine itself did it. I'm not saying it cannot happen, but there's a very, very small chance. So these are the types of scenarios, and this is why I think I don't know of any so-called payouts as yet, but it's going to be quite challenging, difficult to prove, but I'm glad something is in place for our patients who do suffer serious adverse events as a result of the vaccine.
Joan, as a senior health journalist at Bhekisisa, what have been your experiences regarding what Dr. Mackay is saying? We know that SAHPRA is currently investigating a number of cases where family members have said that their loved ones have passed away after taking the vaccine, that they've had adverse side effects. What have you seen from the journalistic investigations that you have done?
I haven't done any specific reporting on the work that SAHPRA is doing now. What I do know from reporting on how this vaccine scheme, injury scheme will work, is that part of SAHPRA's existing infrastructure, the people that are monitoring vaccine side effects, even before COVID vaccines, those bodies were already established, that they will be form part of the monitoring system for the COVID vaccines as well. So that's about as far as my reporting has gone on the severe side effects that may be claimed to the scheme at this point.
So Dr. Mackay has highlighted that one needs to provide evidence and proof that it actually is the vaccine directly that has caused these adverse reactions as well as death. Talk to us about some of what could be covered. What type of reactions could be covered under this scheme?
Yeah, so unfortunately the things that many of us are experiencing now, like the headaches, the fevers, the chills, those things unfortunately won't be covered. That's just actually a very mild side effect and a sign that the vaccine is working. But there are other more severe side effects and rare side effects that, according to South Africa's Medicines Act, would, for example, put you in hospital or prolong your hospital stay or cause some kind of disability or death. So those are very, very severe side effects and very vanishingly rare. Those are the kind of things that would be eligible. The other three things that we know you'll have to tick those three boxes are that you'll have to be able to prove that the injury was caused by a COVID vaccine. That's SAHPRA approved, and that you got it as part of the national government distribution, and that you actually received the jab at a government-listed site. So that's the kind of documentation you're going to have to be able to produce to claim from the scheme. For example, if you got a COVID vaccine, but you got it in one of our neighboring countries that use the COVAX mechanism to get their jabs, the claim would then go through the COVID compensation scheme. So that's what they mean by it has to be if you got the jab in South Africa.
Dr. Mackay, because paperwork and a paper trail is so important in this claiming process, would you recommend that one actually go for a full physical before going for their COVID shots?
So that's a good question. The short answer is no. Just as we don't advise patients to have a COVID test or before that, it is not necessary. Remember, the vaccine is, by and large, very safe, extremely safe, and the severe side effects are also extremely, extremely rare. And I think there's no need to cause panic or to put fear into people and say, rather go for a checkup before you go for the vaccine. There is no reason to. There's a decent screening tools that are in place just before you get the vaccine. And I think we can pick up any potential rare things that may happen. So for all intents and purposes, no need for a checkup. If you are well, relatively healthy, please just go for your vaccine and don't waste any further money and time trying to see if you're going to be okay. For the most part, you will be okay.
And I asked this question, Dr. Mackay, as a worst case scenario, because if at some point you're going to be asked for evidence and documented evidence to prove that you were healthy before the vaccine, then you will need to have that paperwork to show that, because one cannot guarantee exactly how your own body will react after having gotten the vaccine, even though, as you say, the incidences have been relatively few.
Yeah, so I think if you're going to be more specific, then I think those certain patients who have had what we call bad reactions or anaphylactic type reactions, severe allergic reactions to previous vaccines, or for instance, for those who have had severe allergic reactions, anaphylactic reactions to the first dose of maybe the Pfizer vaccine. Yes, those I would recommend that there is some sort of paper trail that it does get documented. But who's going to be paying for those medicals? Again, if you look at clots, we know it's in people who really have a pre-existing platelet abnormality. So if they're very concerned, they can have a blood test to check the level of platelets. But this is not part of guidelines. It's not part of worldwide recommendations, whether it's CDC or our own NICD or National Department of Health. So again, my feeling is that we don't create unnecessary panic. You don't have to have a pre-existing condition or a pre-existing medical to prove that the vaccine did something. You can still prove it after the fact without having had a medical before the vaccine.
Joan, as we wrap up this evening, can one claim on another person's behalf, on a family member's behalf, for example, and what would be the process of claiming should that become necessary?
Well, I think the specifics of South Africa's fund, I'm not entirely sure what they ended up, how concrete they are at this point. But when I spoke to senior health officials about this, they said if it works anything like the US, which is what most of the regulations are based on, is like a US looking at their scheme as an example, because there are many countries that have these schemes in place. There are 25 of these schemes globally, that have all kinds of benefits for. One of them being that it actually, if you get a vaccine out of a feeling of public good, and this is a good thing I'm doing for society, and you get one of these rare injuries, that you'll be compensated fairly. But back to how it will work. In that case, what happens is that if there's a death, then it'll be kind of like a lump sum payout that I guess a family member would be able to claim. If it's something and that person doesn't pass away from it, then it would possibly work as maybe a monthly payment. And that at some stage the health department was thinking of maybe if it's a monthly payment, they could use the existing SASSA payment structure to do those. But I think it would very much depend on individual cases how that payment would work.
I thank you so much this evening for your time, as well as that very important information. That's the senior health journalist at Bhekisisa, Joan van Dyk, as well as General Practitioner Dr Marlin Mackay on the COVID-19 Injury Fund, how that works and who would be eligible for that.